If you're wondering how to get a great deal on PPO health coverage, then this video is for you. Let's start from the beginning. Why would you even want a PPO plan, and why would you have to jump through hoops to get it? Well, a PPO plan, PPO stands for Preferred Provider Organization. Typically, PPOs are the most preferred kind of plans that you could get for health insurance. And why? PPO is going to give you the access to the most doctors and hospitals that are out there. So really, you'll very, very rarely be out of network, and you'll have access to the best specialists in the country. Typically with the PPO, you do not need to get a referral from a primary doctor to be able to go see a specialist. And that just means less hoops to jump through. So it's much easier. A lot of these plans also have the same coverage nationwide if they're part of a really good PPO network. So how do you get a great deal on a PPO? So the first way you can get it, and this is probably the best way if you have access to it, is through your employer plan or through your spouse's employer plan. So if you're married to someone that gets covered by a PPO plan through their employer, typically employer plans are going to be PPO. Some of them are not, but the majority of the ones that I've seen out there are. And that's obviously the best way because your employer is probably paying for all, if not at least some of it. Now, if you can't get it through an employer, you might want to check in your state on the marketplace, because in some states, not very many, there are PPO plans that are available on the Affordable Care Act marketplace. Those are open to enroll in, no questions asked, no underwriting in the open enrollment period, okay, which is November 1st to December 15th. So typically the downside of those is that they're very expensive just because you're not getting any special treatment for being healthy. In my opinion, the best way to be able to get onto PPO coverage, and the reason why this is the best way, is because it doesn't depend on anybody else. It doesn't depend on an employer, or a job that you could so easily lose. It doesn't depend on the government, which really is what controls the marketplace, and that just changes so much year to year. This is the best way because really you have the most control over this, and that's to apply for private underwritten health coverage. So these plans are typically they're guaranteed renewable until you're age 65. So if you think about it, if you apply when you're someone who's healthy, you have no health issues, not very many surgeries or anything like that, no problems, and you apply, you're gonna get a great rate, and that rate is gonna be good, and really carry you until you're age 65. So even if later on you come down with some kind of a pre-existing, what we considered a pre-existing condition, you're going to be fine, and that's the benefit of the underwritten coverage. The underwriting is basically the process by which they approve you. They take you on when they decide that you, in fact, are someone that they would like to be allowed into their pool of insured people because you're healthy and less likely to have a bunch of claims, which would then make premiums go up for everybody, okay? So it makes a lot of sense to do, especially if you're gonna be self-employed for a long time, or you never wanna be dependent on the government or employer coverage. And since the premium for these underwritten plans are typically a lot, considerably cheaper than what you would pay on the marketplace, we're able to supplement those plans to make sure that you have very, very little out of pocket. If something happens that's super common, like an injury or sports injury or something like that, you can put in some supplemental coverage either for accident injury or for hospital, room and board, the kind of things that are more likely to happen, where if that happens, it would meet your deductible and it would really minimize your out-of-pocket costs. So basically what I'm saying is you can be a lot more creative and supplement these plans with more coverage, since the premiums are already so much lower. So if you feel like you're overpaying and you are interested in learning more about PPO coverage and the application process, reach out to me on alexandracontos.com. And if you found this video helpful, or you think some of your friends might find it helpful, please share, like, and comment.